Hi, I'm Dr. Art Mollen. Welcome to Feeling Good. Energy drinks mixed with alcohol are a dangerous combination. They often contain caffeine in high amounts or other powerful stimulants, some of which may even be more dangerous than an excess amount of caffeine. When they're mixed with alcohol and that premix, it poses a significant risk not only to your health but to your safety as well. Drinkers who mix those drinks, they mistakenly believe that the caffeine is going to counteract the effects of the alcohol. Well, that illusion is dangerous. In fact, drinkers who combine energy drinks with alcohol are actually 3 times more likely to leave a bar intoxicated. You may be more alert, but you're just as impaired. And pain during sex is called dyspareunia. It can be caused by a lot of different things. Some of the reasons include vaginal infections or insufficient lubrication. But sometimes there's not a medical explanation for pain during sex. In those cases, sexual therapy could be beneficial. This type of therapy can help to resolve some of the inner conflicts that a person may be having about sex or past abuses. And stimulants, they can increase your alertness, your attention, and even your energy. They're often prescribed for attention deficit hyperactivity disorder and sometimes for depression when other treatments don't work. Well, these drugs include dexedrine and alderol. They're stimulants, they're amphetamines. They could be abused by people who have looking for a sense of euphoria. The risks include irregular heartbeats, a reduced appetite, insomnia, and even addiction. Those stimulants can be found in ADHD drugs such as Ritalin, Concerta, Metadate, and methylene, and taking high doses can cause irregular body temperatures, heartbeats, and even the potential for convulsive seizures. Now, let's take a Skype call from John. John, thanks for calling in. How are you today?
Hi, good. Thanks for taking my call.
Yeah, no problem. What can I do for you?
I had a tingle in my big toe the other night, and I was wondering if it was gout and maybe if I should try some coconut milk. Someone recommended that.
Yeah.
That might help.
You know, it's quite interesting, but coconut milk is something that we often hear because it's one of those herbal types of remedies that could help arthritis and help peripheral neuropathy and back pain and everything. But there's simply no scientific evidence to suggest that coconut milk is going to help anything other than the person who's selling it. So I would suggest that you don't take the coconut milk for that. But you know, when people are having pain in that big toe, let's make sure that they don't have gout. Let's get a uric acid tested by your blood doctor. Your doctor will be able to test it and decide whether or not that you do have gout. And if you do, then allopurinol is a medication they can prescribe for you. Uloric is another newer medication that we often prescribe when patients have the gout. If you have an acute gout attack, you can take something like indomethacin. You could even take ibuprofen. These are anti-inflammatory types of medication. They can often help the gout. So let's get it checked out. Make sure it's not diabetes, or even that tingling in your toe could be coming from pain in the low back, from a disc that might be impinged upon. So good luck to you. Hold off on the coconut milk. I think you might want to save that for something else. It may taste good, though. Thanks a lot for calling, John.
Thanks a lot.
You're welcome. Now it's time for Real Men and Real Talk. You know, many people can do a lot of things well when they're stressed out, but I can tell you one thing that they don't do well, and that's feeling sexy about themselves. Because problems with another individual, or problems at work, or problems with your finances, these types of stress can be sex drive killers. And so make sure that you're close to your partner, especially for women. They have to feel closeness in order to have any type of sexual desire. And alcohol, well, that could make you more open to sex, but too much can numb your sex drive. And I can tell you one thing that's a real turnoff, and that's being drunk, and that's going to turn your partner off. Absolutely, no question about it. And drugs, they can affect your sexual desire. It could be an antidepressant, could be a blood pressure medication. Even birth control pills can actually affect your sex drive. And the best thing for sex drive is feeling good about yourself and feeling good about your body. So that means that exercise. And sex without feeling closeness, well, I can tell you that wrecks the desire and the intimacy more than anything else. And let's talk about sugar addiction. Well, sugar addiction is something that a lot of people feel they have, and a pattern of avoiding and binging, not sugar itself, actually leads to that addiction. Sugar affects the same feel-good brain hormones as those street drugs, and you may feel badly when you skip your daily cookie fix. A low blood sugar gives you a feeling of nervousness, shakiness, even cold sweats. And if you think you don't have a sweet tooth, but you simply crave potato chips or French fries, well, think again. These are complex carbohydrates, and the body breaks them down into simple sugars. So, can you actually beat the sugar habit by quitting cold turkey? No, it doesn't work. Those drastic changes are not something you want to do. You have to make small changes, simple changes. Take it easy. Start with eating more fruits and vegetables and just drinking extra water and eliminating one of those sugar fixes each day. Exercise can also help with that sugar addiction. It's not going to cure it, but it's going to make you feel a little bit better. And have you ever had a panic attack? Well, the main symptom of a panic attack is that overwhelming feeling of fear and anxiety. It starts suddenly. It can last from 5 minutes to 20 minutes, but sometimes even longer, up to several hours. Most of the feelings that occur of anxiousness in the first 10 minutes. It's possible to have one panic attack after another in waves for an extended period of time. The symptoms include a rapid breathing, shortness of breath, a pounding in the chest with some chest pain, and even some stomach upset or numbness and tingling in your hands. But it's a fear that you're going to die or that you're going crazy. You can get treatment. Cognitive behavioral therapy, seeing a psychologist or psychiatrist can help a great deal. And some of the medications, such as the SSRIs, selective serotonin reuptake inhibitors, they can help as well. There are treatments for it. See your doctor, especially if you've been having panic attacks on a regular basis. And finally, let's talk about ginger. It's a common herbal supplement. It's treated for pregnant women who have upset stomach or nausea and vomiting. But pregnant women have to be careful because experts have suggested that in high doses it could potentially cause a miscarriage. A lot of people use it for treating vertigo, painful periods, arthritis, lowering blood pressure, even preventing blood clots. But again, in high doses it can cause stomach upset, heartburn, mouth irritation. So don't take more than 5 grams a day. Ginger can be beneficial for some people, but not for everyone. And if you'd like to ask me a question, send me an email at askdrartmollen@gmail.com. I hope you're feeling good.